'Tis the season of strikes. December 2022 should be the most festive of times. Instead, a winter of discontent. From the NHS, Rail and Royal Mail, to name just a few. With a walkout planned virtually every day in the run-up to Christmas. As the government said today, if it came to it, they'd call in the army. Thousands of military personnel are currently being trained to backfill frontline services. But as nurses in England, Wales and Northern Ireland prepare to stage the biggest walkout in NHS history, today a political plot twist that has angered the nursing union. When the Conservative Party chairman Nadhim Zahawi appeared to use Putin's war in Russia as a reason for not giving nurses a pay rise.
Chasing inflation or above inflation pay deals is not the thing to do right now. This is the time to come together and to, send a very clear message to Mr. Putin.
If Zahawi wanted to unite, he appears to have done anything but. Shortly after, the unions called his comments, quote, a new low for this government. The winter walkouts planned affect virtually every frontline service. Up to 100,000 nurses will walk out on the 15th and 20th of December as unions demand a pay increase above the rate of inflation. With another round of train strikes planned, more than 40,000 workers will walk out on the 13th, 14th, 16th, 17th, 23rd and 24th of December, with further strikes planned in January. And Royal Mail staff will strike on the 9th, 11th, 14th, 15th, 23rd and 24th of December, with yet more walkouts planned by teachers, firefighters, civil servants, the traffic and travel industry. As today the Shadow Education Secretary said there was a compromise to be had on pay.
I think ministers should be getting around the table and trying to find a way through all of this. That's all the unions are asking for. They want to have a conversation with ministers about trying to avoid the possibility of industrial action. Our staff right across our public services, whether that's schools or hospitals, have worked incredibly hard. And yes, that's about pay and they want to be recognised for the work that they do, but it's also terms and conditions. They're under enormous pressure.
This evening, train operators offered rail workers an 8% rise over 2 years, and the clock is ticking. Union bosses and Network Rail now have until tomorrow to reach a deal and avert walkouts across the UK.
Well, as you heard in Minnie's report there, nurses are also due to strike later this month in what's set to be the biggest walkout in NHS history. Well, Pat Cullen is General Secretary of the Royal College of Nursing and she joins me now. Thank you for coming in. So we heard the Cabinet Minister and Chair of Conservative Party, Nadhim Zahawi, saying that you are playing into Vladimir Putin's hands and causing division. What do you think about that?
Look, when the Tory party chairman said this morning, I actually had to listen to it a few times. And if he thinks he's playing a clever game, then that's up to him. But it's about him taking responsibility in his party for the decade of cuts that they've given nurses to their pay. And that has caused record numbers of our nurses to leave the NHS. And he's saying, look at Putin. So to say that our nurses don't understand the spike in the cost of living is again an insult. They're obviously living through that with a decade of pay cuts. So we're well aware of what's causing that. But our campaign and the roots of our campaign goes away before that, a decade and longer. So the people of this country and our nurses know only too well who's responsible for the crisis within our NHS.
So have these comments added more fuel to the fire?
I've been contacted by many of my profession today to say, a bit like myself, did we really hear the Tory party chairman say what he said this morning? And unfortunately we did. And it is disrespectful, it's shameful, and it's a clever game as far as we're concerned.
OK. What about this plan to get the military in to drive... I know you don't represent ambulance workers, but to drive ambulances and so on. And what do you think about that in general, the idea that the army would step into key roles?
Well, it's not for me to decide what way the NHS is going to be run and how safe it's going to be on a day of industrial action. That's for the NHS and government ministers to do. What we have done is being careful, and we will make sure that services such as critical care, chemotherapy services, dialysis and other services are protected on those days. So patients will continue to get the level of care and service that they're getting at this point in time. That's being safe and that's being responsible, and we'll continue to do that, or our profession will. What I would say, isn't it ludicrous that our nursing staff, those that are the lowest paid in the NHS, have continued to work under that pressure with those responsibilities for years, coming on duty every day and every night with a depleted workforce, 47,000 nurses missing. And on a day that they're taking industrial action, and that responsibility is handed to the government, they're saying it's too much for us, we can't do this, and we're not willing to do that. So they're having to bring in the military, pharmacists and others to do it, when they have turned their back on our nursing staff year on year.
But Ms Callan, there will be people who are sympathetic to nurses, but who are planning to go into hospital for an operation, or they have a loved one in hospital, and they'll be terribly anxious about the prospect of these strikes. What would you say to them?
I would say to them, isn't it a disgrace, really, that they're one of the 7 million people that has sat on waiting lists year on year, with the government turning their back on patients as well as nursing staff. And why are they on those waiting lists? They're on those waiting lists because there aren't the nurses there to care for them within those services, with 47,000 nurses absent every single day. Our action is as much for our patients as it is for our nursing staff.
OK, I'm sure we'll speak to you again soon, but enough time. We've run out of time for now. Thank you very much.